Hi everyone. From our last post, which is getting tons of views, we had a lot of really great questions about how can you cut the pectoralis major muscle or the chest muscle and still maintain its function. So the pectoralis major muscle is a very broad fan-like muscle. It originates in the clavicle or the collarbone, as well as the sternum or the chest bone, and then it has a few accessory attachments here on the ribs, and then that large broad part of it, those fibers coalesce onto the humerus or the arm, so that when this muscle contracts, it brings the arm closer to the center of the body, and that's what if you work at the pec deck at the gym. So when we put an implant in, what we do is we just release some of those accessory attachments down at the bottom, and then we just kind of scoot that implant in through the side here. We're maintaining most, if not all, of the attachments along the chest bone and the clavicle, and all of this still then coalesces and inserts down into the humerus or the arm. So this muscle is still able to perform its primary function. We've only released some of the accessory attachments here, and that's why this surgery works so well. If you're not a surgeon, I guess the idea of cutting a muscle is very foreign and scary, but for a surgeon, cutting a muscle is sort of routine. If you imagine how is a surgeon supposed to, get to your appendix or your gallbladder to take them out or operate on your abdominal contents, they have to cut through the muscles. If they're trying to do, joint surgery, they're often cutting through muscles. So this is routine for a surgeon, but I can understand why it's scary if you're a patient. But putting these implants under the muscle, making some minor cuts in it are pretty routine. And I'd say probably the most common way that implants are put under the muscle. Thank you so much, and please let me know if you have more questions. I'm happy to provide more videos. Have a good day.